Hello, everyone. Thank you for joining us today. My name is Luke Wilson, Associate Director of Admission here at the Massachusetts College of Pharmacy and Health Sciences. Today, we're going to be discussing the various healthcare professions that you can look to pursue after doing an education here with us at the Massachusetts College of Pharmacy and Health Sciences. I realize that's a lot to say. If you wish to abbreviate to MCPHS, you're welcome to do so. You'll find I'll be doing it during this presentation. The first thing that I like to make sure people understand before we get into the process of this presentation, forgive me, there's a lot of different pieces of where you can touch with these different careers as far as within the bigger picture of the healthcare industry. You have this purple category, which is healthcare practice. Think of that as hands-on patient care. Nurses, doctors, pharmacists working directly with patients. There's also research and disease prevention. That can be lab work. That can be statistical research work. There's business and technology. That could be the people working on the back end of things, making sure healthcare facilities are operating well. That could be people working as patient care as well, where there's different technologies you're applying towards that patient care. And then we also have this blue category of life sciences. Think of that as different application of healthcare in industry practice. So different organizations that are out there making different healthcare products. And that isn't just limited to pharmaceutics or device development. That's also related to advances in environmental wellness and agriculture wellness and nutrition wellness and things like that. It really expands into a lot of different things. So as we go through each slide, you'll see one or multiple of these badges at the top right corner as we go through here. You'll also notice on each slide, we're going to have a brief description of the job or the career that we're discussing, along with how you would get there through education, and then also salary earning ranges or average salary. All of those figures are based off the Bureau of Labor Statistics. They're not numbers we're just pulling out of a survey or something like that. So this is, genuine information. Take it for what it's worth, and I encourage you to use this presentation as an opportunity to really start to explore different healthcare careers. If you're thinking, well, I want to go into healthcare, and I think I like this profession, but look at everything here, do your own research, look within yourself and identify what might be the best fit for you and what your goals are. So without further ado, we'll get rolling here. And we're going to start with being a pharmacist. There's a few different ways in how you can approach this depending on the schools that you're looking at. I think when you want to look at the career as a whole, though, you want to look at big picture of what is your role, and then also what's your process in getting there, and what's that end result going to be. And I say that's true for a lot of things, but relative to pharmacists itself, if you want to pursue this career, you need to understand chemistry and you need to love chemistry because pharmacists are exceptional chemists. Essentially, at the end of the day, their role isn't just making medicine. Beyond being an exceptional chemist and understanding what you're doing in creating that medicine, you also have an important role in educating your patients on how that medicine works within the body, things that, effects that you'll feel when you're taking that medication, for better or for worse, ways that you can medicate negative outcomes of it, ways that you can enhance the benefits of that medication that you're experiencing. So there's a lot more that goes into it instead of just simply, well, here's your prescription, sir or madam. Beyond that, I think it's really important that folks understand the work environment of it as well. Anytime that I describe any of these, I think it's worthwhile for you, if you have an interest, find ways to talk to people that work in the field and get an understanding of what the everyday work environment might look like. As pharmacists, may be very different from nurses, may be very different from chemists that are working with different organizations making medicines at the industrial level. There's a lot of variety in there. It's important to understand what that work environment is and how it might fit with you. Now, becoming a pharmacist, like I said, there's a few ways in how you can get there. For us, we take the most direct route possible. It's a direct entry 6-year Doctor of Pharmacy major or program, depending on how you would like to consider it. Now, in that process, all 6 years are done right here with MCPHS, and your seat is yours. You're not at risk of losing it because someone has a 1/10 of a point GPA mark higher than yours at the end of a certain year. Your seat is yours. It's designed for you to keep that seat and progress, graduate, pass your NAPLEX, that is your licensure exam at the end of the program, and then graduate, and go into a high earning career. Typically, your salary is going to be in the six figures, as you can see in the range at the bottom here. That range is representative of all across the United States, so not just in higher income areas versus more rural, lower income areas. That's a range all across the board there and where it can fall. Next up is nurse or nursing. If you wish to pursue nursing as a career, first and foremost, it's important to understand that you are the front line of healthcare. You are often the first folks that are meeting with patients when they walk into the room. In addition to that, empathy and understanding and understanding of the welfare of your patient physically and emotionally are going to be very important. But you're also very critical problem solvers, whether it be in an emergency situation or in an observation situation where a patient has been in your unit for a while. Whatever it might be, you need to be intelligent and you need to be quick on your feet to make sure you're treating that patient in a manner that's best suited for them and their health. Now, becoming a nurse, the industry standard now is to get your bachelor's degree in nursing. We don't like going through an associate degree process because oftentimes, you need to go back for a bachelor's degree anyway, as is with a lot of different healthcare-based careers. So we go straight to a bachelor's degree for us. No associate degree offered through MCPHS. Now, we approach this process a little bit differently. It's a 3-year bachelor degree, not a 4-year bachelor degree. Now, you might ask, how do we get there? We get there by having you take courses over the summers of your first and second year. So at the end of your first year, in a traditional fall and spring semester, you'll have a summer semester. That'll be the same for your second year. And your third year is just fall and spring. So you're still doing the equivalent of 4 years worth of work, but you're doing it at an accelerated pace with those summer courses. Now, you might say that sounds like a lot without any break time. There is break time. You essentially go semester on, month off over the course of those 3 years of education. Salary range also is very high for students that graduate and they go into their field with a bachelor's degree. If you look at a very important resource I encourage all students to consider looking at, it's a college scorecard. An average bachelor's degree median earnings is around $40,000 to $50,000. Nurses are starting off 60s, typically higher, especially here in the Boston area here. So I think it's a really excellent paying job. It's extremely fulfilling. While it is hard work, the fulfillment end on the other side of it is also extremely high as well. And students get a lot out of it, or I should say people get a lot out of it. Now, MPAS refers to physician assistant work. MPAS are the initials for Masters of Physician Assistant Studies. That is the degree that you would attain here at MCPHS. Now, physician assistant roles are super important. They have a lot of the same responsibilities as a physician. Oftentimes, they will meet with patients in place of the lead physician because that lead physician may have a lot of patients that they're managing at that time. As you may know, we need more doctors in the world. A physician assistant fills a really important role to free up those doctors for other things that they might be handling at that time. When physician's assistants come into play, they can examine, treat, diagnose, prescribe medicine, almost everything short of authorizing surgery. There are some surgical procedures that physician assistants can get certification to proceed and do in certain states as well. So I think it's really important that you look at, if you wanted to be a physician assistant, you have a lot of responsibility, and it's really important to understand that you do a lot of direct contact with your patients as well. Now, becoming a physician assistant, it's a 2-part process where you need a bachelor's degree and you also need your master's degree of physician assistant studies. With MCPHS, we follow a pathway program where, again, your seat is yours. As long as you go through and progress and you have all of the work needed to be done, your seat's waiting for you. We still interview students at the end of the bachelor's degree portion of it. In total, it's 3 years of undergrad and then 3 years of graduate work, 6 years in total, similar to the pharmacy program. Earning potential also is very high for physician assistant workers as well. So physician assistants often are going into 6-figure salaries, just like pharmacists. And again, it's something where you have required clinical work, just like nursing or pharmacy students would as well. That often comes towards the end of your program. Becoming a radiation therapist, this falls into patient care. There's a little bit of technology to it as well, but a big component, and I would argue the biggest component of this job, is compassion and empathy. This is a career where you are delivering chemotherapy to patients who have cancer. You get to know your patients very well as you go through that process. Being an excellent listening ear and being there for them through that process is really an important component to that job. You also have to spend a ton of attention on detail to make sure the safety of your patient is at the top of your list while you go through there and administer radiation to treat their cancer. Now, there are associate degree programs out there. Usually, though, the industry standard is a bachelor's degree, which is what we offer. Similar to nursing, this is also a program that is completed in a 3-year process with summer work happening as well, where, as I mentioned before, you go semester on, month off over the course of that 3-year period to go and complete your bachelor's degree in radiation therapy and sit for your licensure exam. When it's all said and done, there's excellent salary range and earning potential in this role as well, starting off at $75,000 and ranging up into the 6-figure area as well. There are some students that pursue specific master's degrees as well to get into larger management roles and things of that nature as well in this career field. DPT refers to Doctor of Physical Therapy. So if you wish to become a physical therapist, understand that anatomy and physiology and how the body works and functions is at the core function of your job. Very much focused on rehabilitation. And when you're dealing with physical therapy, you're dealing with rehab of large muscle groups, large motor skill function. Oftentimes, we instantly relate this to injuries that occur in everyday life, whether you hurt your back, if you're an athlete and you hurt your knee, like we always hear about, or something along those lines. Physical therapists are the folks that are working through the rehabilitation process there. Now, it's really important to understand if you wish to go into physical therapy, you yourself want to make sure that you're in pretty good shape as well, because oftentimes you're helping people who have limited mobility issues, and you're going to need to help them in a lot of different things. So there's some lifting that goes on there. You want to make sure you're prepared for those kind of things. Now, in becoming a physical therapist, I think it's important you understand that this is often also a bachelor's degree into master's degree process. Again, the Massachusetts College of Pharmacy and Health Sciences, we organize it where your seat is yours. We organize it as a direct entry program, also 6 years, 3 years undergrad, then 3 years of graduate work. You take your licensure exam, you graduate, and you begin working as a physical therapist. Again, this is also a very lucrative career, starting off, in the 70,000 plus range in your career, and that extending all the way out to over 6 figures in a lot of instances for folks. MOT refers to Master of Occupational Therapy. So similar to physical therapy, this might be helping people with rehabilitation. It may also help folks with that have common mental illness issues that causes them other different physical discomfort or physical limitations. When it comes to a difference between physical therapy and occupational therapy, as I mentioned, physical therapy is like large muscle group rehabilitation, big range of motion rehabilitation. Occupational therapy focuses more so on fine motor skills. So rather than flexing your hand, or rather than moving your whole arm, it's more along the lines of flexing your hand and getting it to do the things you want it to do, like holding, a kitchen, holding a knife or a fork or a writing utensil or something along those lines, right? Now, becoming an occupational therapist, again, it's a similar process where you need a bachelor's degree followed by a master's degree in occupational therapy. For us, we have students start off with a bachelor's degree in health sciences. Again, it's a pathway program where your seat is yours as long as you're doing the necessary work to maintain your seat, being GPA work and things like that. Your seat is yours and you progress directly into that graduate program, Masters of Occupational Therapy. This is a 5-year program. So you go 3 years of undergraduate work followed by 2 years of graduate work with us. And again, excellent earning potential starting off in the 70,000 range up into 6 figures for you the year as well. Now, MD is a common term that a lot of us know. It's a medical doctor. MDs are essentially at the pinnacle of our healthcare hierarchy, if you will. Overall, they are the experts that are focused on your healing, focused on maintaining good health. I think an important thing to understand if you want to go into this career is you kind of need to permanently be curious and permanently have a hunger to learn more. Because when it's all said and done, we still don't know everything about our planet. We still don't know everything about ourselves. Medical doctors play a vital role in continuing advancements in science. And that's why you have those two different buttons that I mentioned at the beginning of the slide up here. It's not just direct patient care, it's life sciences application. Medical doctors are often also used in different research fields to help make advancements in medical science as well. Now, becoming a medical doctor, again, you have a multi-tiered process in your education after you get out of high school. You need to get a bachelor's degree, and then you need to get into medical school. And oftentimes you need to do a residency after that as well. I shouldn't say often, pretty much always. So I think an important component in when you're looking at your education is choosing a right school to help you through that process. And first of all, being a qualified medical school applicant, that's something that MCPHS focuses on greatly with a lot of direct work with your faculty there. When it comes to medical school, again, you don't specialize what kind of doctor you want to be until you're getting into medical school and you start doing work around there, whether your goal is to become a surgeon or a gastroenterologist, or if you want to become an OBGYN. Those are all things that you decide later on down the road, not at your undergraduate study level. Now, as far as major is concerned, there's a lot of different majors that you can use to pursue medical school. At MCPHS, we specifically have a pre-medical and health studies major that we encourage students to consider because of how we build out the program, not just from a curriculum standpoint, but as I mentioned before, a faculty standpoint as well in your interaction with them to make sure the focus is around, well, yes, I'm going to get my bachelor's degree, and yes, there are careers I can pursue with this if I choose not to do medical school, but your first goal really is medical school when it's all said and done. So we want to make sure you're taking all the necessary steps there and you understand where you're at in your process really consistently as you go through there. And again, there's an excellent salary range, as we know, for folks going into and becoming medical doctors, typically in the six-figure range. Now, a DO, this is a little bit less known. This is a doctor of osteopathic medicine. In the grand comparison of DO versus MD, within the United States, it's the same license. They have the same responsibilities. They have the same different parts to their job that you would find. You can be a surgeon with a DO, you can be a surgeon with an MD, you can be a gastroenterologist with a DO, you can be a gastroenterologist with an MD. The big difference that you'll find here is really in your training. Osteopathic doctors tend to be focused a little bit more on the whole body and the holistic review of it. Now, I think it's important to understand that medicine has gone through a lot of different changes over the last several decades here, last 2 decades in particular, where more and more traditional medical doctors are looking at osteopathic medicine and osteopathic methodology and how they're treating their patients. So that gap between the two is really more narrow now than it ever has been before. Now, becoming an osteopathic doctor or an MD, it's a similar or the same process really, with the only difference being at the medical school level, which degree are you pursuing? Are you pursuing a DO or an MD? So you first need to get your bachelor's degree. Again, with us, I would recommend following our pre-medical and health studies major because of the focus around preparing you for medical school there, and then applying to a medical school of your choice. We do have some internal pathway programs and articulation agreements with several different medical schools out there. If you're interested in that, I'll have our contact information at the end of this presentation. Please reach out. We're always more than happy to explain those details for you. And if you wanted to go into osteopathic medicine, you'll find salary range very similar to an MD, if not identical. Now, a healthcare manager can be a lot of different things. Very often, healthcare managers are an essential middle piece of making sure healthcare facilities work, making sure new products are getting developed, making sure the actual supply chain cycle of what we need in everyday life for our common health is intact and working well. They can be medical administrators, they can be insurance agents, they can be part of the government and different organizations there, like the Food and Drug Administration. There's really an endless range there within the healthcare space of what healthcare managers do. Now, I think it's important to understand that this isn't limited to just one particular major. if you're not interested in being a patient care focused role, say, for example, you get queasy at the sight of blood, that's me. Um, you don't have to go and become a doctor or a nurse to then move over into a healthcare manager role. While some do, many times you have similar degrees that can lead into these functions. For us, we have a healthcare management degree that is focused in particular around that administration and policy role and policy development role, I should say, within healthcare, and making sure not just organizations are functioning optimally, but also facilities themselves. As I mentioned before, how are you managing the supply chain of the different pieces of equipment that you need and the different medicines you need on an everyday basis to really treat your patients well? There's a really wide range of earning potential in these roles as well. The Bureau of Labor Statistics gives us a figure of 77 to 135,000. However, I know a number of our graduates that are earning well beyond that 135,000 range that's indicated here that are working as healthcare managers in their careers. Now, if you wish to be a medical sonographer, that is also known as an ultrasound tech. Some folks might pursue an associate degree. Typically, a bachelor's degree is a standard here as well. I think it's important to note that sonographers or ultrasound techs, you should have an interest in technology here, because technology is an essential part of what you're doing. It's not just holding up a wand to someone's stomach and seeing what's going on there. It's understanding the technology that's working and how it works to get the best images possible to help that patient as much as possible. I think it's really important that you understand being approachable and being empathetic is also a very important component to this job. People also often equate ultrasound techs to those who are helping mothers and families see children for the first time. That's not the only use of it. It's used every day in emergency care situations. It's used every day in a whole variety of different, abdominal cavity situations, internal medicine situations. So there's a few different areas in where you can go with this career. But again, being caring and being understanding of your patient at that time is super important when you're going into this job. Little secret fact to this as well, medical sonographers need to have a poker face. You can't be going and taking images and sort of saying, ooh, ah, or. Patients are going to ask you questions. Oftentimes, it's not going to be your role to tell them what those images mean. That's the role of the doctor to come in and explain those details to them, or sometimes the physician assistant. Earning potential, again, bachelor's degree is really the industry standard at this point. And similar to how I explained some of those other programs, our medical sonography program, similar to, like I said, nursing in particular, it's an accelerated 3-year bachelor degree as well with those summer classes. And again, you see the salary range at the bottom here with a bachelor's degree, a very lucrative career that you can pursue. Becoming a nuclear medicine technologist is also a direct patient care role where you also are using a lot of technology in that process. Nuclear medicine technology is a specific type of imaging and therapeutic use of technology. So it's specifically using radioactive drugs that could be inhaled, that could be injected. There's a variety of ways in how it gets introduced into your patient's body. And then you have different imaging or therapeutic applications there. So it can be used to look at specific systems in the body. But I think it's important to note that it's not just as basic as take this, let's put a screen over you and see. There's a lot of math skill that goes into this to make sure that you're giving the right dosage to the patient. And I think it's also important to note that it's not as simple as just putting a screen. Sometimes you have specific tools like a wand or something like that. So dexterity is going to be important here as well. Again, this is a bachelor's level degree that you need in order to go and pursue this career. Again, this is a 3-year bachelor degree with us. Where you have those required summer hours or that required summer work as well. This is also a clinical-based program, just like our previous program there, sonography and nursing, where you have clinical rotations or clinical internships that you'll do. And again, excellent salary for when you graduate and go into this field and to go into the work. Really rewarding as well. A pharmaceutical researcher, sometimes known as a chemist, is someone who also loves chemistry. They tend to be perfectionists. And they're really needed in the engineering and the development of different medications. This can be going into strictly hospital-based research, working for hospitals or different institutions, or this could be on the industry side, working for different organizations, like some of the big names that we know in everyday life when we see commercials here and there and the different medicines that they make. Now, if you wish to go and become a pharmaceutical researcher, I think it's also important that there's a lot of different ways in how you can pursue that education. Within the Massachusetts College of Pharmacy and Health Sciences, it can be very specific and granular, like a pharmacology and toxicology degree, which is looking more so at efficacy and testing efficacy of medicines. Or it could be pharmaceutical science, which is kind of another phase in drug development as far as industrial manufacturing. How do I scale this medicine that I'm making to reach the population that needs it? It could be 1 million people that need it. It could be 1 billion people that need it. That involves a lot of difference in how you're going to be processing and making that medicine. So pharmaceutical scientists are really important in that process. A lot of the time, people will pursue different masters or PhDs in these fields. And I think it's also worth noting it's not just limited to that. We also have a chemistry program that focuses on pharmaceutical chemistry. I think it's important to understand that there's a few different ways in how you can get there. Again, reach out to us, ask us questions, try to identify which will be the right way for you. And again, there's excellent earning potential in this just for the bachelor's degree, but when you go and you get those different master's or doctoral degrees down the road, those obviously help you with career advancement and higher earnings too. A clinical researcher is often referred to as a biologist. So rather than working with chemistry and going through and doing the compounding and making medicines, this is more so working with human material, human tissue, and identifying what's going on within the human body, right? So oftentimes you're working with different fluid or tissues that will get taken from patients, and it's about testing those to figure out what exactly is going on with them. Again, this can be something that falls into research or hospital work with research work within a hospital, or this could be working with different industries or different organizations that are trying to build out new medicines, new immunotherapies, new different treatment processes, or different medical devices to treat people that have different ailments out there. Again, this starts with a bachelor's degree. For us, we have a degree in medical molecular biology. We also have a number of other degrees where this may make sense for you to pursue, whether that's a biotechnology degree or something that's affiliated there. I think it's important to note that the salary range for this is really, really wide. That lower end of the salary range is really more so speaking to an associate's degree level education or something like that in a real rural area of the country. It's very common that I find our students are making towards the top of this salary range right out of undergraduate. And a lot of them tend to pursue a master's degree or sometimes a PhD degree to, again, advance their earning potential. Many of our students fall into the six-figure range shortly after graduating. Now, an OD, not to be confused with DO, we're flipping it here. This is an optometrist. So any of you who have glasses, contacts, have issues with your eyes on a common everyday basis, you know your optometrist. However, believe it or not, it's not something that people normally gravitate to when they think patient care because it is a specialized group. Obviously, optometrists are focusing on ocular health, making sure, their patient's vision is excellent. What will we do without our vision? A lot of us will ask ourselves sometimes. I think it's also important to note that optometrists oftentimes work independently and have their own businesses. So you need a little bit of business acumen as well if you're planning on going into private practice and understanding what that process is going to look like. Now, becoming an optometrist is similar in the nature of pharmacy or physician assistant or physical therapy, where you need to do a bachelor's degree and then you need to do specific professional schooling. In our case, optometry school. Typically, optometry school is either 3 or 4 years in timeline, depending on how that school organizes it. Again, with MCPHS, we make it where we have a pathway program. You do your undergraduate studies in pre-medical and health studies. And then as long as you enroll in that pathway program from the start, you indicate your plan is to become an optometrist and you meet all your requirements, we have a seat waiting for you in our optometry school. This can be a 7 or an 8-year program, depending on your academic progression. Some students choose to do 4 years of undergrad. Some students are ready for optometry school after 3 years of undergraduate. And again, an excellent salary range when you're going into this field, oftentimes starting in 6 figures. Now, public health specialists have a really wide range of work. They have a very important role within our healthcare systems. This isn't just a government work application, working for states, working for the federal government, and looking at demographic trends. That's really a small segment of it. This can be researchers. This can be a whole variety of different healthcare manager roles as well. Public health specialists and healthcare managers often work in tandem. This extends out to media application. Whenever you hear a news report about a new study finding links to treating cancer with this medication or this immunotherapy, it's often public health specialists that are working in those roles to explain that information out to people. You know, the world just is, we still talk about it on a regular basis. We went through the COVID pandemic. Public health specialists were essential in making sure we were following best practices in order to keep ourselves healthy and safe in that process. Now, becoming a public health specialist, there's a variety of ways in how to get there. Sometimes students will do a generalized degree. At MCPHS, we realize the role and the importance of it. We have a specific bachelor's degree in public health. We also have a master's degree in public health as well. We have many students that pursue the master's degree, even though they might pursue a different undergraduate degree. And we have a lot of students that follow that progression from public health into a master's of public health as well to go into that career. And there's a pretty wide salary range here as well. A lot of that is due more so to where you may be living in the country and what average salary may look like there. DVM refers to veterinary medicine, a vet, a doctor of veterinary medicine, however you would like to phrase it. Some people may say, this doesn't necessarily match with the rest of this presentation because we've only been talking about humans. Well, at the end of the day, as someone who owns a dog, my pup is essential to my mental health. My mental health is essential to my everyday health. We should look at veterinarians in the same vein as we look at as our regular doctors. They are very important to our society, and it's not just what we think of as our everyday pets. They're super important for our nutritional health. At the end of the day, agriculture needs veterinarians to treat animals. Those animals are necessary not just for meat and animal products we consume. It's also essential for regular everyday products that get consumed or that we need. You know, it affects vegetarians as well. Fertilizer comes from animals at the end of the day. Their health is essential. So that's a really long way of explaining how important veterinarians are. But I think what's important in noting, if you want to go into this career, similar to being a doctor, where you need your bachelor's degree, and then you need to go into veterinary school and then a residency, your undergraduate studies are important there. But if you want to go through that process there, I think the main critical thing you understand here is your patient care. Well, your patients can't talk to you. Observation is really at the core function of this role. You need to be very sensitive and very keen on what's happening with your patients as you touch them, as they might react to how you're speaking to them, because they can't tell you what's going on. So you have to do a lot to figure that out. More importantly, you need to be excellent at listening, and you need to be excellent at asking important questions to their owners, because they're the ones that need to explain it to you. And at the end of the day, they may not know what's going on with their animal. They just know this one thing happened. And you need to discern a lot of information all out of that one little explanation there. At the end of the day, there's also extremely high earning potential for veterinarians, oftentimes starting off just under 6 figures, more often than not moving into 6 figures in your career. Now, dental hygienists are patient care roles. It's very important to understand that hygienists are often the people we see when we're getting our teeth cleaned. You're going to see them probably twice a year in most instances. And I think what's most important in this role is a steady hand and a fast hand. We don't want to have our patients with their mouths open for 2 hours on end. You need to have excellent dexterity, and you also need to make sure that you're really advocating for oral hygiene. It's typically something that's not talked about enough other than brushing our teeth. We forget about flossing consistently. I was guilty of that for a long time until my hygienist, well, now going on 5 years with them, explained really all the things that not flossing consistently was getting to, but too much information. We'll talk about that another time. But I think it's really important to note that dental hygienists have a lot of different responsibilities. It's not just simply someone that cleans your teeth. It's someone that does a lot of different disease screenings. They do a lot of x-rays and review of those x-rays. They're often the ones that are reporting to dentists saying, hey, this person needs some extra attention here in this area or something like that. So their role is super important in our everyday health, not just our oral health. A bachelor's degree is often required for many different offices if they're looking at their dental hygienists. Similar to some of our other bachelor degrees that have clinical roles or things like that. We have it as a bachelor's degree, and we do that in a 3-year bachelor's degree process, where again, you go semester on, month off, over the course of, technically it's just 32 months. You're still doing the equivalent of 4 years worth of work in a 3-year period with a month off in between each semester. Salary range is excellent for these folks. I attended a school that had a dental hygiene program. I have a number of friends that are making over 6 figures in more metropolitan areas where they live now. There's a lot of really excellent job resources for you beyond working as a hygienist as well. I have many friends that have gone into research fields and things like that, product development and product testing, things like that. So think of dental hygiene not just strictly as working in patient care. It may expand into other roles as well. DMD refers to dentistry work. So, that next step up after being a hygienist would be going to dental school. Again, similar to hygienists, dexterity is super important. Most dentists have insurance policies on their hands, just like surgeons do. You need to be able to get in and out of mouths quickly, but also you need to be sensitive and you need to be very observant of your patients while you're going through that. We don't want to go and cause any, undue stress or undue harm in that process. On top of that, there needs to be some visualization and some technological interest for folks as well. As someone that has a couple of different crowns in my mouth, all of them have been made artificially with different imaging technology and printing machines. My dentists that I worked with in that process were very keen on that technology. So you have to have an interest there. Now, becoming a dentist, like I said, you need to get your undergraduate degree. You need to go to dental school, and you need to do typically some form of residency or extra work as well if you look to specialize in different areas. Now, as far as undergraduate studies are concerned, again, there's a few different majors in what you can pursue. Again, we recommend doing our pre-medical and health studies major in order to do that. Fun little side fact, if you guys were to look up on our website, we also have a pre-dental dental hygiene major where you can also fit in the prerequisite work you need to become a dentist. If you wish to be a hygienist and maybe one day become a dentist, that's a good option to pursue. But I would only do it if you wanted to be a dental hygienist first and then wanted to do dental school, maybe after a year or two of working as a hygienist, which isn't a bad idea. I actually have some friends that pursued that. If you don't wish to be a dental hygienist, do the pre-medical and health studies major with us. Again, focuses on the prerequisites you need and also the resources you need to be a good dental school applicant, not just going through the motions of taking classes and applying and see what happens. Be more goal-driven in that undergraduate study process. Make sure you're identifying a program in a school that's going to support you in that, not just say, we'll take the classes and then we'll see what happens. Now, salary range also very high, starting off in 6 figures for this role, going up into over $200,000, depending on the type of work that you're doing and where you're doing it. A radiographer, this could refer to an MRI, magnetic resonance imaging technician, or an X-ray tech. Now, depending on what you're doing, we have specific bachelor's degrees that go to that, and I'll talk about that in just a moment. If you're going into these roles, similar to sonography, it's important that you have a little bit of a poker face and you're not explaining what's going on to the patient. That's for doctors to do. But then also B, being aware of your patient and being observant of what kind of pain they might be in, and really working with them to make sure that you're making it the best experience possible for them. Because oftentimes when you're working with someone and giving them an X-ray or an MRI, they may be in pain at that time. So being understanding and having really excellent interpersonal skills to sort of explain how to move the body to get the right images necessary without causing undue pain is a really difficult skill to develop. And it's something that you want to make sure you have at the forefront whenever you're working with patients. Also, super important that you understand anatomy and physiology. That's kind of an obvious one. You're taking pictures of what's going on with them internally here. Now, as I mentioned, we have two separate degrees in what you would pursue here. We have a bachelor's degree in magnetic resonance imaging, and we have a bachelor's degree in radiography. Radiography is for X-rays. Magnetic resonance imaging is for MRI work. Both of these are also our 3-year bachelor degree offerings because, again, these are both clinical programs. And something that I think is also worth noting about these is if you're looking to go into them, you should have some sort of interest in the technology being used as well. There's a really wide earning potential here as well. In some areas, that lower range in 49,000 or so, that's typically with associate degree level. Bachelor's degree is typically where you're starting off at the higher level of this range. And again, these are fields where you can look at different master's degree work to go into management roles and increase your earning potential as well. Now, a PsyD or a PhD in psychology, this is for folks that aren't looking to become psychiatrists. If you wanted to become a psychiatrist and prescribe medicine, you need to go to medical school. Refer back to what I talked about in that MD medical school process. If you wanted to become a clinical psychologist, that is someone who focuses on therapy and working with patients in different ways to improve habits. Right? So that's a different approach of patient care. We're looking at mental health and wellness when you're talking about a PsyD or a PhD in psychology and psychologists in general. Now, to get into this field, you need a bachelor's degree in psychology or a related field, and then you look into a master's or sometimes doctoral psychology program to pursue this. And again, excellent earnings in this field, salary range starting off right around $75,000 and over 6 figures as well. Now, when it's all said and done, you might ask, well, why do I really want to pursue a healthcare career? This sounds kind of hard to do. Well, there's a few different reasons why. One being there's job security. It is the highest job growth area industry in the country, as a Bureau of Labor Statistics projects all the way out to 2030. On top of that, there's extremely high earning potential in these fields, as I already documented going through these slides here. I think it's important to note that there's a pretty big update to this second bullet point. Our graduates have a median income of actually closer to $125,000 10 years after they're taking their first steps on our campus. In addition to that, you should want to go into healthcare because it's a good thing to do, and it's something that we need, not just in this country, but across the world. Access to healthcare is a massive issue. And I don't just mean access in terms of being able to go out and see a doctor. I mean it in terms of having enough facilities, not just from a geographic standpoint, but really from the standpoint of we have a lot of people and we don't have enough doctors, nurses, pharmacists, etc., to help people in these fields. On top of that, though, I think it's important to note that healthcare has to be continuously evolving and changing and improving. A lot of the careers that are going to be existing by the time 2030 rolls around don't have titles yet, some of which haven't been created yet. They're in their infancy. They've only been around for a couple of years and things like that. So I think it's really important for us to understand that pursuing a career in healthcare is not only good because it's lucrative and you can make good money, but more so because it's needed and because you can really help people in doing so. Now, as I mentioned before, I want you to reach out and ask all our questions. At the bottom right, you see our contact information for email and our phone number. More importantly, though, I'd encourage you to come and visit campus and get an idea of exactly what would be a good fit for you. We have tours available Monday through Friday. Very easy to go and find them at www.mcphs.edu/visit. Again, I want to thank you for your time and joining us today. If you ever see me around campus, certainly wave hi and say, hey, I saw you on YouTube. Love to hear that. But other than that, thank you so much for joining us and have yourself a wonderful day.